Good afternoon. Welcome and thank you, Community Living Oshawa Clarington families and guest panelists for joining us on this webinar today. My name is Jean-Claude Legault, better known as J.C. Legault, President of CLOC's Board of Directors. March 11th was declared the National Day of Observance in memory of the people lost to COVID and the overall effect the disease has had around the world. Before continuing with this meeting, I would like to ask a moment of silence to acknowledge clients and staff who have been seriously affected by COVID, and particularly in memory of one person served by CLOC who is deceased. Thank you very much. Now, at the 1-year anniversary of this awful pandemic, all of us have been affected in ways we would have never imagined. The way we work, our relationships, our leisure. You, the family members, have faced many hardships and frustrations, of which I can only imagine, while striving to maintain encouragement to your loved ones as much as possible. Now, finally, there is a light at the end of this very long tunnel. Today, we are together mainly to hear CLOC's plans for vaccination, in the hope that in the very near future, we will finally be out of this dark cloud that has overshadowed us for long. We are fortunate to have with us a very knowledgeable panel made up of experts that can also answer any of your questions regarding the vaccination program and any other COVID-related concerns. I will now introduce our panel. We have Janice Doolin, Director of Operations, and also representing today Terry Gray, the Executive Director. Marnie Salonius, the moderator of today's discussion. We're happy to welcome again Terry Lynn Fisher, Community Living Durham North, who is also the lead of the vaccine rollout in the region. And Karen Collins, Assistant Manager Operations and Healthcare Coordinator. I look forward to hearing with you the updates and discussion. I will now allow our moderator, Marnie Salonius, to proceed. Go ahead, Marnie.
Thanks, JC. Good afternoon, everybody. As JC mentioned, my name is Marnie Salonius, and I am the Manager of Resource Development and Public Relations for CLOC. I'm pleased to be here with you today, moderating this discussion. And before we get started, just to familiarize everybody with using the Zoom functions, we did ask prior to the meeting for families to submit their questions to us, and we will be addressing those questions at the end of the meeting during our question and answer period. However, if you would like to submit a question on anything that you hear during our presentation today, if you follow along on the screen, you will see there is a question or Q&A button at the bottom of your screen. It looks like two little chat bubbles, and if you click on that, a screen will pop up and you are able to type your question at the bottom of the screen. And once you hit enter, that question will come to everybody on the panel. And if we have time at the end of the meeting, we will address those questions that have been asked today. If we don't happen to have time, we will either address the questions individually, or we will send out a memo to families in order to answer those questions for you. We are recording this presentation today, so if you would like to re-watch it, or if you have other families that you're connected with that may want to hear the information and just weren't able to get here today, we will be posting that for families to watch. And I think now we're ready to get started. And we're going to start out with hearing from Janice Dooland, who is the Director of Operations for CLOC, and she's going to provide you with some COVID updates.
I'm on mute. Thank you, Marty. Hi, everyone, and thank you for joining us today. We do have some exciting things to share with you. The first and foremost thing will be information around the vaccine and the progress and developments around there. But I also have a few other things that that may be of interest that we'll just sort of update you on in terms of what CLOC's been doing for the past year. And speaking of that, whoever would have thought that you're a year into this? So it is hard to believe all that has gone on in this COVID year that we have more than endured. So I just want to say thank you for your patience and your support during these challenging times. I know it's been really difficult to not see some of your loved ones in the way and in the manner and the frequency that all of us would have liked. And it's been a tough go for everyone not being able to see their family and loved ones the way we would like to, but we have managed and we'll continue to try and do the best we can to accommodate visits and whatever they end up looking like. You'll hear shortly from Terry Lynn Fisher, who is as JC said, very high profile within the Durham community and on provincial networks around the vaccine rollout for, especially for the developmental services sector. So really appreciate you coming in, Terry Lynn, and sharing some information. I know that families are quite anxious to find out what's happening and who's got it and who's getting it and what the plan is. So we really look forward to having some information from you. I also just want to take a minute to recognize the staff who have been in the throes of COVID for the last year and have shown up and been so incredibly creative and inspiring and supporting during this time. I know it hasn't been easy. It's tough enough to work during difficult and stressful times, let alone having to double and triple up your PPE and wearing masks and shields and still make really personal connections with people. So we are just so pleased and thankful for the high quality staff that we have here and the dedicated staff that we have that are making sure that the people that we support and love are well looked after and safe, but also entertained and making sure that their days are full and meaningful. So I just wanted to take a minute to recognize that it's not easy, and we all thought it was going to be a couple of weeks. So as you know, some of you may know, we also had a bit of a surprise audit this last couple of weeks. So the ministry called on I think Monday and said that they were coming in the next day to start ministry audits around quality assurance measures. So although they're a little bit compacted, we're not getting measured on all 300 and some odd, but we did have 9 programs audited, and this afternoon after we finish this we will get our exit review with the ministry. But in speaking with the ministry auditors, we did come out really well once again, and lots of kudos for high quality services and documentation and support. So again, a real tribute to the CLOC frontline staff and the supervisors for making sure that even during the most difficult times, we are meeting and exceeding standards in most of the ways. So we're really proud of that. Around the clock. So we will be putting out our around the clock newsletter within the next week or so. Really looking forward to this new edition. It's been a while, I know, since we've had anything come out. So there'll be lots of pictures and links and information and really cool things to see what everyone's done at home during this time. And Marnie's put a lot of work into it. So Marnie, thank you for all your work on that and getting that out. A quick update on Dewey's Cafe. As many of you know, we do have a Dewey's Cafe out in the Bowmanville Library, and it has been closed since the beginning of COVID. partly due to some renovations, but then it has also been shut down due to COVID. So we are not anticipating Dewey's coming back online and up and running until the rest of the operations within Bowmanville and the downtown core is fully reopened. So we won't be opening on a limited basis there at all. So we look forward to the day that we can reopen Dewey's again, and we'll make a big announcement once that happens. We also have our first virtual version of Steps to Inclusion Walk, Run and Roll-a-thon, which is in partnership this year with the Running Room. We'll have a 2-week time period where you can complete a 1K, 5K, or 10K exercise of your choice. We'll be looking at registration and pledges for fundraising for community living. Our goal in this is to raise $10,000 for our My Life, My Community, My Way campaign. And Marnie will be sending more information out on that in terms of registration and the link and that. But anyone who does register with that will get a little goodie bag, including a t-shirt and some good little memorabilia around this. So we look forward to hearing more about that as it progresses. We're also in the process of securing a lottery license for an online 50-50 draw. It'll take place, we're hoping, by the end of April that we'll be able to get the license and get that going. So again, stay tuned for some more exciting details around that we can share with friends and family. Also in December, we were very pleased to know that we were a recipient of a United Way Emergency Community Support Fund grant, which enabled us to create some kits and some hygiene kits and some activity kits and some food for people within the residential programs, but also people living out on their own independently or semi-independently who have been really hit by COVID in terms of their ability to be out and socialize, but also restricted in what they can even do to have food and hygiene pieces. So we've been able to send numerous kits out to support people so that they can have some quality and some supports through that. We also have started some free online bingo pieces, partly through the campaign, and then one of our residential programs in Marland has taken carried on the torch, and we'll be doing I believe Thursday night virtual bingo for anyone who is supported within CLOC. So I think Marnie will have some pictures and some different things with that coming out as well. We're also very pleased to be the recipient of a French culture grant. That was an 8-week French social circle program. We had 12 people supported through that. And one of our staff, Monica Galati, was heading that up with our wonderful board president, JC, also helping out and taking on that task. It was really a very, very resounding success. They did some videos around traditional French meals and French restaurants, learning to speak French, and at the end of it, part of the funding from the grant was also used to purchase some French language books to encourage the continuation of French outside of that. So that has just wrapped up, and it was a great success. So JC, thank you for your time and energy and input into that as well. Just in closing, I just want to say that CLOC has shown great resilience during these really difficult times. We couldn't have done it without the support of the families. Staff work very, very hard, but we also know that we do that with the support and care of all of you behind us and beside us, and sometimes in front of us, advocating and cheering and helping. The drop-offs, the calls, the check-ins have been absolutely wonderful. So from the bottom of all our hearts, I speak for everyone at CLOC, our board of directors. Thank you for being the families that you are, not only to the people that are supported, but to our staff and to us. You bring such value, and we really can't say enough about the support that we get from our families on a day-to-day basis, and especially during this really difficult year. Your patience and support has meant so much to us. So thank you so much for that. And I will turn this over to Marnie so we can move on to the information that you signed up for.
Thanks, Janice. So it's my pleasure now to introduce to you our guest speaker, Terry Lynn Fisher. Terry Lynn is a long-term employee of Community Living Durham North. She's worked there for 29 years and she's pretty much done it all. She started working residentially when she was in college and has since worked a few positions with them, including support worker, employment counselor, team leader, residential manager, and currently she is the residential director and has been so since 2017. So when COVID came along, Terry Lynn reached out to contact public health and asked if she could be part of the vaccine rollout team. And she was welcomed because they didn't have anybody representing the developmental services sector on the task force. So Terry Lynn is very familiar with what we go through on a daily basis here at CLOC, and she understands the unique challenges that have taken place across all of the developmental services sector during COVID-19. So join me in welcoming, please, Terry Lynn Fisher.
Thank you. Thank you for the introduction. I have the privilege of being a part of the Durham Region Vaccination Rollout Task Force. Other members included on the task force are representatives from Ontario Health, Durham Public Health, paramedics, Brock House, First Nations, Lakeridge Health, North Durham Family Health Team, Kira Community Health Center, and the LIN, which is Local Health Integration Network. The task force is working within the phases created by the government and have been busy vaccinating the priority populations identified in phase 1. These include staff, residents, and essential caregivers in long-term care and retirement homes, healthcare teams and healthcare workers, adult, Indigenous, other congregate living for seniors, seniors over 80, and housebound chronic home care. There are currently 2 methods in which you can receive the vaccine. The first being at a local clinic and the other being by a mobile team. The mobile team in Durham consists of 10 paramedics who will travel to locations when it's not possible for the identified population to attend a clinic. Just recently, our staff were identified as healthcare workers, therefore making them a part of the priority population being vaccinated in phase 1. All of our staff have been given the opportunity to receive their first dose at a local vaccine clinic. The rationale for providing the vaccine to our staff before providing it to our supported people is that staff are accessing the community frequently in their personal life. For the most part, people living in our group homes have been sheltering in place since March of 2020. We provide our staff with proper PPE while at work, and receiving the vaccine is an additional measure to keep everyone safe. On March 9th, an announcement was made by the National Advisory Committee on Immunizations. They recommended extending the vaccine dose interval times to be 4 months or 112 days. Phase 1 is expected to be completed by the end of March 2021, with phase 2 coming into effect at the beginning of April 2021. The people we support remain in phase 2. However, due to some advocacy that's been occurring on the provincial level, supported people have now been placed into the priority 1 sequence in phase 2. This means they're at the top of the list. The focus right now is on congregate living settings. More advocacy will happen for all other supported people to determine when they can become available to receive their vaccine. Some other priority populations identified in phase 2 are youth homes, other high-risk congregate living, for example, shelters, residential treatment facilities, communities at greater risk, migrant workers and the homeless, and primary caregivers. The task force is trying to identify the best possible venue to provide the vaccine to the people in this priority population, as booking appointments for people living in shelters is just not a realistic approach. Currently, the rollout plan for congregate living settings, which is group homes, is that the paramedic mobile team will travel to each location to administer the vaccine. The task force priority population subgroup is developing a sequence approach using some predefined criteria, such as number of doses per location, medical complexities of the population being vaccinated, basic geography and distance between locations and drive times. Included in phase 2 are primary caregivers. We've advocated that essential visitors should be included in this category. So that would mean once phase 2 is completely open, essential visitors would be eligible to receive their vaccine at a local clinic. This also means that essential visitors could come to the group home on the day that the mobile team was holding their clinic to receive their vaccination. Agencies can expect to receive a letter soon requesting specific information about supported people. As you may already know, everyone who receives a vaccine must be entered into the COVAX database, and the information we provide to public health allows this to happen quickly. The key factor in having a timeline that we can expect to have our supported people and essential visitors receive their vaccine is dependent upon the amount of vaccine available. The task force's main goal is to get the vaccine into as many arms as possible while following the established government guidelines. The real message here is that agencies need to be proactive and have all their supported people's consents signed and accessible. The reality is we could receive a phone call saying that we're next on the list and have as little as 24 hours notice to be prepared. Thank you.
Thank you, Terry Lynn. As I mentioned at the beginning, if you have any questions about the information that Terry Lynn has discussed, please type them down in the question and answer box, and we will do our best to address them at the end of this meeting. Now we're going to move on and introduce Karen Collins. She is the, I'm going to get this wrong as I did earlier this week. She is the assistant manager of operations healthcare coordinator. And Karen's going to speak to us about her newly developed role and how her role is helping CLOC to manage COVID-19.
Hi, everyone. I am sharing an office with Wendy, so I am going to keep my mask on. And I know you all understand. So my role as a healthcare coordinator, this is a brand new position and I'm super excited about it. And I'm here to assist the supervisors and to ensure that the best quality of care for all of the individuals that we support is second to none. As a lot of you know, as being family members and also supporting the individuals, obtaining resources at times can be extremely challenging. But I have built a really strong rapport for the last 15 years working and supporting the individuals in a medically fragile home. And I've made a lot of connections. And so I know that I can count on them for their assistance. From physiotherapists to occupational therapists, speech and language for feeding assessments, working with Lynn, specialty stores such as Durham Medical, motion specialties for mobility aids, feeding equipment, incontinence supplies, pharmacies, and the list goes on. And one of the other challenges we have supporting individuals is navigating through the system, and I'm here to help. If it's a form to be filled out for ODSP and MSN form, the special necessities form, all the forms that we fill out for ADP, I can help with those, and I can help you navigate through the system to get those resources that are required. And also one really important aspect of my job that I'm excited about, and hopefully we can fill the gap between Lakeridge Health and community living. Sometimes when the individuals that are supported go into the hospital, they have a tendency of discharging them quickly than expected. And the staff at the group home, they're absolutely fabulous, but they're not nurses. And they really require that special care. So I want to be there for that discharge plan, to come up with a plan and to ensure that all resources are at the group home before we bring that individual home. Vaccinations. So Terry Lynn, amazing, great. She's shared some fantastic information. We have actually 237 people on our list ready to go, ready to get that vaccination. We're ready. So Terry Lynn, when that phone call comes, we'll be right behind you. We're there. And this is, moving forward, we're so excited to get this. And Terry Lynn, thank you for sharing all that information. So that's my new position. I'm super excited about it. And if you have any questions or concerns, don't ever hesitate to reach out.
Thanks, Karen. I think now we're on to the question and answer segment. Sorry, I'm just reading here some of the things that have come in. All right, so I'm going to deal with the questions that were submitted ahead of time, and I believe Terry Lynn has already answered some of them in the information she discussed. One of them was, will there be a vaccination clinic held at CLOC? And I guess I'm gonna tap you, Terry Lynn, and see, you can start out with an answer, and then if somebody else needs to jump in, maybe we can have them jump in.
So the mobile team, as I mentioned, will be traveling to all your different congregate living settings, so your group homes, to administer the vaccine to supported people. And at that time, I guess it's what CLOC wants to do to arrange things. I mean, the staff are able to go to clinics, and they're in phase 1, and the message has been for staff not to wait to have their vaccine with group homes when the mobile teams come to the group homes, because that's phase 2. It's the beginning of phase 2, but staff are put in phase 1 for a reason. So the message is, please go as soon as you can to get that vaccine in your arm. Does that answer the question?
We hope so. Next question, and again, lots of unknown factors here. Once people are vaccinated, when can we start to visit our family members again? And I think, Janice, this is a good one for you to tackle.
We still have to follow the guidelines set out by the province and the ministry and public health. So I can't give you an exact date or a timeline on that. There's a lot of unknowns around the vaccine still, and whether or not you're still contagious, whether you can still contract it with lesser degrees of illness. So the vaccine is not a panacea where we suddenly will not be under the throes of COVID anymore. So the vaccine, while helpful, very, very helpful in fighting this, will not be a blanket, I got my vaccine, so we're all safe and we can do these visits again. So we're really gonna have to open things up slowly and very carefully. We're certainly hearing an awful lot about this third wave with the variant that is predicted to come in. So even with the vaccine, we still have to be very, very careful. I am hoping that over the next while, with the weather getting nicer, we can do some outdoor visits at the very least to at least make some of those connections again that we haven't been able to. But again, that's a hope on our part. We still have to take our direction from public health and the province and the ministry around when we can open things up. Durham right now is in a red zone, so those visits are still suspended at this point, but we certainly understand that we're all chomping at the bit to get in there for sure. So as soon as we can, we will let you know, and under what conditions, and also what sort of that process will be. So we look forward to that day.
Thanks, Janice. I think, Karen, I'm going to ask you to answer the next question. This question is coming from somebody who receives services from CLOC but does not live in one of our residential homes. This person would like to know when they are going to be able to receive their vaccination, because they want to get back to normal life, as we all do. Karen, you're on mute.
Better? As soon as we know something, we'll be reaching out to all those folks who we've called to send out that 5-page consent. So as soon as we know anything, we'll be reaching out immediately to give you some information. And until we know, we can't pass anything forward, but we've promised everybody we'll be in touch, and we'll be good with that promise. We'll reach out.
Excellent. Well, we've got lots of great questions coming in from people who are attending today. Once the people that live in our group homes are vaccinated, will unvaccinated parents be able to visit indoors or outdoors? Janice, I'm throwing that one to you.
I think that it's all kind of the same thing. We've had our staff were vaccinated around the 4th of March, and they got their first shot. I'm going to guess that until everyone gets their second shots, that we're still going to be incredibly cautious. Whether you're vaccinated or not vaccinated, we will be looking when we can at having sort of those outdoor distanced visits as soon as we're allowed. So I'm not sure right now if it's dependent on who's vaccinated and who isn't. We still have to go with whatever zone we're in within each of the regions. And a red zone doesn't change because of vaccination. It changes because of numbers that are contracting COVID. So that'll be right. At this point, the numbers within the region will be more contingent on what happens than whether people are vaccinated or not vaccinated. Outdoor visits would probably be our first step, and people will still be wearing their PPE and being socially distanced. So as safe as we can make that, we will, and as soon as we can get that out there. But at this point, I'm not sure that it's contingent on vaccination more than it is around what zone we're in the region. Terry Lynn, you can jump in on that if I'm misspeaking at all.
No, I don't really have anything to add, sorry.
Thank you. Terry Lynn, I'm going to throw this one to you. Do you know which vaccine will be administered?
Well, that's a good question. Right now, it's Pfizer. I did hear on my call this week that we're expecting Moderna to be coming to Durham, but there hasn't been any predetermination. You know, the sooner it can happen, we're dealing with Pfizer and Moderna. I mean, I know AstraZeneca has been geared towards some pharmacies on people the age 60 to 64 right now, but that's for the population. So I don't know, it'll be whatever is available to us, but I'm guessing it's Pfizer or Moderna at this time.
Yes, I understand that a lot of our employees that have been vaccinated have been receiving Pfizer. So, but whether that changes in the future, who knows?
And the consent form, the 5-page consent form is for Pfizer or Moderna. Yeah. I haven't seen the consent forms for AstraZeneca or Johnson & Johnson. So that consent form is for those two particular vaccines.
Good to know. Karen Collins, over to you. Have any contraindications to the vaccine been identified? For example, obesity or autoimmune issues?
Am I on mute? No. There's some that have been identified, and I think have that conversation with your doctor. Watch for any symptoms. Just do your research. We've been sending a lot of research out, a lot of information. That research has been done, so read that. Every individual is going to be different, but I think having that consult with your doctor is the most important thing before anyone gets that vaccination. Better to be safe than sorry. Get some advice. We're not doctors.
We certainly aren't. And it looks like this is the last question we've got posted right now. Please, if you do have any other questions, pop them into the question and answers now so we don't close without answering them. Janice, I'm going to pass this one to you. If a staff member decides not to get their vaccine, what precautions will be kept in place around those staff members?
I think it would be the same across the board. There's lots of controversy around people being vaccinated and those who opt out for health and medical reasons or for their own personal reasons. And we don't have enough research. We don't have enough information yet around that. We can't force people to get a vaccination. It's not mandatory. We will put safeguards in place if there happens to be an outbreak, but that would be for the person's safety. What we're hearing right now about the vaccine, it is, like I said, it's not a panacea. So you at this point may still be able to contract COVID, but the effects of that are greatly reduced. And my understanding also is that you also could spread COVID still, even if you are vaccinated. So people who are not vaccinated, the greatest risk will be to themselves. The rate of contraction and spread we don't have data on yet because it's too early in terms of whether or not the load is less, if it's being spread or not. We are getting some indicators that it may be a bit less with people who are vaccinated, but it is still there. So people are still going to be wearing their PPE and their full PPE for quite a period of time. And we'll continue to do that until we have some more data and research on that, and then can make a more informed decision on what happens with people and people we support who are not vaccinated, and what the implications and safety pieces are for them. But at this point, it'll continue to be business as usual, with everyone wearing the face shields and the masks and enhanced PPE and precautions. I did see another question, Marnie, about essential visitors. Did you see that one?
I apologize. I did miss that. If parents are considered essential caregivers, does that mean that both parents are eligible to get the vaccine, or is there a limit to who is considered the essential caregiver? And I think, Terry Lynn, I'm going to ask you to answer that, please.
I know with long-term care, I think they put limits in place, but the task force I'm speaking with is really, it's up to the agency to decide the criteria on who is classified as an essential visitor. And at this point in time, we're not putting a limit on. So if both parents frequently visited their loved one, both parents are on, I work with Community Living Durham North, but both of those names are on our essential visitors list. Yeah. I'm not sure. I'm guessing CLOC would be the same. I can't speak to that.
Yes, we've put both mom and dad on the list. Yes,
we've done that for in most instances where we've looked at the regular visits and the people who their support needs are reliant on parents coming in and doing pieces. So both family members or both parents have been deemed essential visitors. What we haven't done is included all of the siblings and people who may be in the home that don't necessarily come. We're really looking at those essential visitors that are visiting or coming in to perform tasks that we can't. So yes, long answer to a short question is both parents would be considered essential visitors in most instances. If you have any questions, call the supervisor or give Karen or I a call. We have the list, so we can let you know. And if you're not on the list, then we can discuss how you get on that list. But most of our essential visitors have been put on the list.
Great. And I think now that we've answered everyone's questions, we're going to turn back to JC, and he's going to close off our meeting for us. JC?
CLOC's webinar for CLOC families. And please be reminded that this presentation was recorded and it will be distributed to those who were unable to attend. In addition, if there were any questions that didn't get answered during this time frame, they will be addressed individually or in an upcoming memo to all families. For myself, more important than being a board member, I am first and foremost, I've been a volunteer for 11 years, offering a small way my time and talent to certain activities with the people served by CLOC. Many of those who have become dear friends. During the pandemic, I've tried to stay in touch via musical and other activities, but I do miss tremendously the personal contact, and I am looking forward for it to resume. Myself and my fellow board members are continuously informed of the tremendous efforts that the frontline staff, the heroes who have applied all care possible through these unprecedented times for the benefit of our clients. Along with Terry Gray, Executive Director, the senior and leadership teams, please be assured of our continued support. On your behalf, I thank our special guests, Terry Lynn Fisher, moderator Marnie, and the panelists Janice and Karen, and of course our executive assistant Wendy Shaw for our expert technical assistance today. On behalf of CLOC's board of directors and the senior and leadership teams, stay healthy and remember, we are all in this together. Thank you and have a good day. Have a great weekend.